Good to see everybody back after lunch. And there are a couple of folks we're waiting on who are stuck in traffic, although I think we're, well, at least, yeah, great. Hi, good to see you, Jeff. Excellent. Okay, so we're going to go into the second part of our workshop, and this is going to feature the cross-sector case studies. Each of the speakers will provide a brief description of their initiative, then identify ingredients and mechanisms which allowed them to develop a successful initiative. They'll consider the place of each of the 4 overarching considerations that we discussed up to this point, how they've been addressed, and explore barriers and challenges faced as well. After each individual presentation, we will have 20 minutes for open dialogue with the panel. In preparing for this part of the workshop, for these case studies, we asked the presenting team to consider a couple of questions, including to make sure that we can see which sectors are included in their project, the lessons learned from the initiative, whether that was focusing on inclusion, health equity, sustainability, leadership, or measurement. The barriers to establishing the initiative, again in the context of these 4 overarching issues. What may be needed to accelerate movement forward in this cross-sectoral work. And finally, what are the core features or elements of their initiative that are necessary for scale and spread? What are the features that need to remain flexible to allow for local adaptation? So to start us off with our first group, the National Prevention Council case study presentation and discussion, I'd like to ask Sylvia Rowe from SR Strategy and a Roundtable member to do the introductions.